topic of my presentation is study of correlation between glycated hemoglobin level and lipid profile in type 2 diabetes mellitus. Type 2 diabetes mellitus has emerged as a global health crisis with its prevalence rising rapidly in both developed and developing nations. This increase is attributed to several factors including population aging, sedentary lifestyles, poor dietary habits, obesity, and improvements in diabetes management which have extended the lifespan of diabetic patients. Globally, millions are affected by this condition and projections suggest that this number will continue to rise significantly in the coming decades. India in particular is facing a diabetes epidemic with over 100 million people currently living with the disease and many more in the pre-diabetic stage, indicating a vast population at risk. Dyslipidemia in diabetes is typically characterized by elevated triglycerides, decreased high-density lipoprotein cholesterol, and increased small, dense, low-density lipoproteins cholesterol. This specific lipid profile, known as diabetic dyslipidemia, is a major contributor to the development of atherosclerosis. Advanced glycation end products formed due to chronic hypoglycemia further exacerbate vascular damage by inducing oxidative stress and endothelial dysfunction, both of which promote atherogenesis. Additionally, the atherogenic lipid profile often exists even in pre-diabetic individuals, suggesting that lipid disturbances begin early in the disease course. This study was conducted to assess the prevalence of dyslipidemia among patients with type 2 diabetes mellitus and to explore the correlation between glycemic control and lipid profiles. The goal was to determine whether patients with good glycemic control exhibited more favorable lipid profiles compared to those with the poor control. Establishing such a correlation can guide clinicians in early identification and management of dyslipidemia in diabetic patients. Prompt intervention, including lifestyle changes and pharmacotherapy, can help prevent the onset of diabetes-related complications, ultimately improving the quality of life and reducing overall burden of the disease. The aim of this study is to investigate dyslipidemia associated with type 2 diabetes mellitus and to examine the correlation between HbA1c and the lipid profile in individuals with type 2 diabetes mellitus. Materials and methods. This prospective observational study was conducted at the Department of General Medicine, Institute of Medical Sciences and Research, Mullana, from August 2023 to December 2024. Ethical approach has been obtained from the Ethical Approval Committee of Institute of Medical Sciences and Research, Mullana. The study population. This cross-sectional study included 100 patients diagnosed with type 2 diabetes mellitus based on the American Diabetes Association criteria. Patients were selected according to the specific inclusion criteria. The patient was selected according to specific inclusion-exclusion criteria and provided written informed consent. A detailed history was recorded, including symptom duration, complications, family history, and lifestyle habits. Clinical examination focused on signs of anemia, insulin resistance, and hyperlipidemia. All participants underwent laboratory testing for fasting blood sugar, postprandial blood sugar, HbA1c, and lipid profile. Lipid profile testing included total cholesterol, HDL cholesterol, and triglycerides, while LDL cholesterol was calculated using the formula HDL, total cholesterol minus triglycerides by 5 minus HDL. Patients was categorized into two groups based on HbA1c level, Group A with HbA1c less than 8 and Group B with HbA1c more than 8%. The lipid profiles of both groups were compared and the correlation between HbA1c and lipid levels was statistically analyzed using the t-test to determine significance. In this study involving 100 patients with type 2 diabetes mellitus, the distribution of subjects by sex was equal in both groups based on HbA1c levels, with each group consisting of 25 males, 25 females, indicating a balanced sex ratio. Age-wise, both groups had a fairly even distribution, though a higher proportion of older individuals was seen in the group with HbA1c more than 8%. In Group A, the most common age ranges were 41 to 50 and 61 to 70 years, while in Group B, 30% were in the 61 to 70 age group. Regarding dyslipidemia, it was significantly more prevalent in Group B, where 82% had combined dyslipidemia and only 4% had normal lipid profiles compared to Group A. where 54% had combined dyslipidemia and 18% had normal lipid levels. Overall, 89% of the total diabetic population exhibited dyslipidemia, highlighting a strong link between poor glycemic control and lipid abnormalities. In this comparison, glycemic control, several severe statistically significant differences were observed. Mean HDL cholesterols were higher in the poorly controlled group than in the other group, with a significant difference and a strong positive correlation with HbA1c. Furthermore, 70% of patients in group B had elevated LDL levels compared to 48% in group A. Triglyceride levels also showed a significant increase in poorly controlled group compared to the group A, with a moderate correlation to HbA1c, and 92% of group B had elevated triglycerides versus group A. Additionally, the total cholesterol by HDL ratio was significantly higher in group B compared to group A, with a very strong correlation with HbA1c. Overall, these findings indicate a consistent and statistically significant relationship between poor glycemic control and an unfavorable lipid profile, including elevated LDL, triglycerides, total cholesterol by HDL ratio, which are the key contributors to cardiovascular risk in diabetic patients. The cross-sectional study was conducted to assess the prevalence and pattern of dyslipidemia in patients with type 2 diabetes mellitus and to evaluate the association between hyperglycemia as indicated by HbA1c and lipid abnormalities. A total of 100 patients with type 2 diabetes included in two groups. Group A, HbA1c less than 8% and Group B, HbA1c more than 8%. Various lipid parameters including total cholesterol, HDL, LDL, triglycerides and total cholesterol by HDL ratio and non-HDL cholesterol were analyzed and compared between the two groups. Out of the total sample, 89% of the patients demonstrated dyslipidemia defined by at least one abnormal lipid parameter, consistent with the previous studies showing a high prevalence of dyslipidemia in diabetic populations. Group B, where the HbA1c was more than 8%, had a higher prevalence of combined dyslipidemia than Group A. Triglycerides were the most commonly elevated parameter, followed by non-HDL cholesterol, HDL, total cholesterol by HDL ratio, total cholesterol and HDL cholesterol. Total cholesterol levels were significantly higher in Group B than in the Group A. A strong positive correlation was observed between HbA1c and total cholesterol. The LDL cholesterol was also significantly higher in Group B versus Group A, with a positive correlation to HbA1c. The study reveals that dyslipidemia is a highly prevalent among patients with type 2 diabetes mellitus, particularly in the patients with the poor glycemic control. HbA1c correlates strongly with the total cholesterol, LDL, triglycerides and non-HDL, while showing an inverse correlation with the HDL cholesterol. These findings highlight the importance of monitoring lipid profiles alongside glycemic control to prevent long-term cardiovascular complications in diabetic patients. Early intervention targeting both glucose and lipid levels could substantially improve clinical outcomes and reduce the disease burden. My conclusion is that this is a cross-sectional study of 100 type 2 diabetes mellitus patients, which revealed that 89% had dyslipidemia, with 68% exhibiting combined lipid abnormalities. According to NCEP ATP3 guidelines, elevated triglycerides, non-HDL cholesterol, LDL cholesterol and total cholesterol by HDL ratio, total cholesterol and low HDL cholesterol were commonly observed. Patients with HbA1c above 8% showed significantly worse lipid profiles compared to those with lower HbA1c levels. HbA1c demonstrated strong positive correlation with most lipid parameters and a negative correlation with HDL cholesterol, suggesting its potential role as a useful marker for identifying dyslipidemia in diabetic patients. Thank you.